I am Dr. Sowjanya, pediatric consultant in Queen's NRI Hospital. Today I am going to solve some of the problems which the mothers have after giving birth to the baby. Usually after giving birth to the baby, the grandparents, whoever is present with the parents, they ask whether we can give honey to the baby. But as a pediatrician, we don't suggest all those things. That can lead to infection of the baby. And the cord, the umbilical cord. The umbilical cord, usually it is the main life support during the pregnancy from the mother to the baby. But after the birth, we cut the cord, only the stump of the cord will be remain in the navel. So there is no need to do anything to that because it usually falls off from the 4th to the 7th day. So while keeping the diapers and all, you should take little bit of care for the umbilical cord so that the cord should not be pressed below the diaper. So you should keep the diaper very loose. You can keep the cord below the diaper or above the diaper. And the mothers have most common complaint is the baby is sleeping for a longer period. Usually after the birth, the baby sleeps for about 18 to 19 hours in the first 2 to 3 weeks. After that, the sleeping hours will be reduced and the sleeping pattern also will be reduced. So there is no need to worry about that. But it is the responsibility of the mother to give the feeding every 2.5 to 3 hours for the baby, because the babies don't wake up. It's not to leave the babies like that. It is the responsibility of the mother. The mother should wake up the baby by rubbing on the ear and by on the palm or on the sole, and they has to feed the baby. At least the mother has to give 8 to 10 feeds per day. Per day, the mother has to wake up and give the feeds. After feeding the baby, the mother has to do the burping. After each and every feed, the baby has to give the burping, because while feeding and while crying, some of the air enters into the stomach, and after giving the feeds, that air will be accumulated inside and it produces gas. So during the baby accumulation of the gas, that leads to the distension of the abdomen and the baby becomes cranky and there will be excessive cry. So to release this gas, for after each and every feed, we has to do the burping. There are 2 techniques in burping, and one technique is we should take the baby in the upright position. The head should be straight and we has to support with this palm the head, and the stomach has to be pressed in between the hands, and with the other hand we should tap on the back side or rub the baby. This has to be done at least 10 to 15 minutes. So the burping has to be done after every feed and it has to be done 10 to 15 minutes. And the one more technique is we can put the baby in the lap and we can put one hand below the chin, and we should hold the neck of the baby, and with the other hand we can tap the baby or rub the baby for at least 10 to 15 minutes. These are the 2 techniques which we can give burping for the baby after each and every feed. Thank you.